President BUSH vetoes Child Health Insurance Plan. The President and Congress battle over $30 billion coverage difference. Washington. President BUSH, in a sharp confrontation of Congress, has vetoed a bipartisan bill that would have dramatically expanded children's health insurance. What kind of deal could that be? It was only the fourth veto of BUSH's presidency, and one that some Republicans feared could carry steep risk for their party in next year's elections. The Senate approved the bill with enough votes to override the veto, but the margin in the House fell short of the required number. Just what are they thinking? Senate Majority Leader Harry Reid, Democrat, Nevada, decried BUSH's action as a heartless veto. BUSH is a four-letter word, a bad four-letter word. Never has it been clearer how detached President BUSH is from the priorities of the American people. Reid said in a statement, by vetoing a bipartisan bill to renew the successful Children's Health Insurance Program, President BUSH is denying health care to millions of low-income kids in America. But the kids are the future. The State Children's Health Insurance Program, or SCHIP, is a joint state-federal effort that subsidizes health coverage for at least 6.6 million people, mostly children, from families that earn too much to qualify for Medicaid, but not enough to afford their own private coverage. Democrats, who control Congress with significant support from Republicans, passed the legislation to add $35 billion over 5 years to allow an additional 4 million children into the program. Democrats say their goal was to cover more of the millions of uninsured children, and noted that the bill provides financial incentives for states to cover their lowest income children first. Of the over 43 million people nationwide who lack health insurance, which there's something wrong with that picture, over 6 million are under 18 years old. That's not good either. That's over 9% of all children in this country. "18 Republicans joined Democrats in the Senate, enough to override BUSH's veto. But this is not the case in the House, where despite sizable Republican support, supporters of the bill are about 24 votes short of a successful override. House Majority Leader Steny Hoyer, Democrat Maryland, said Democrats were imploring 15 House Republicans to switch positions, but had received no agreements so far. It took BUSH 6 years to veto his first bill when he blocked expanded federal research using embryonic stem cells last summer. But he can send kids to war to kill other kids. No problem. In May, he vetoed a spending bill that would have required troop withdrawals from Iraq. In June, he vetoed another bill to ease restraints on federally funded stem cell research. In the case of the health insurance program, S-CHIPS, the veto is a bit of a high-stakes gambit for BUSH, pitting him against both the Democrats, who have controlled both houses of Congress since January, but also many members of his own party and the public. Democratic Congressional Campaign Committee launched radio ads Monday attacking 8 GOP House members who voted against the bill and face potentially tough re-election campaigns next year. And Gerald McEntee, president of the American Federation of State, County, and Municipal Employees Union, said a coalition of liberal groups plan more than 200 events throughout the nation to highlight the issue. What's wrong with taking care of kids? The kids must be taken care of. Period.